Thank you, colleagues. We have quorum now, so we will resume. Welcome to our Electronic Community Service Committee meeting on June 7th, 2022. Due to the COVID-19 pandemic, committee members are practicing physical distancing and are participating electronically. Regional Chair Redmond, Councillor Galloway, Councillor Jowett, and I are present in the council chambers. I'm going to call on Julie Hale to conduct the roll call, please.
Thank you. Regional Chair Redmond.
Present.
Councillor Vivanovic. Councillor Jaworski.
Here.
Chair Clark.
Present.
Councillor Lorenz.
I'm here.
Councillor Jowett. Councillor Erb.
Present.
Councillor Nowak.
Present.
Councillor Kiefer. Councillor McGarry.
Present.
Councillor Armstrong.
Present.
Councillor Harris. Councillor Shantz.
Present.
Councillor Foxton.
Present.
Councillor Galloway.
Present.
And regrets from Councillor Strickland.
I'll note that both Councillor Jowett and Councillor Harris are with us. They've had to step away from their computers briefly. I would like to acknowledge that the land on which we gather virtually today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. The Dish with One Spoon Treaty is a treaty between the Anishinaabe, Mississaugas, and the Haudenosaunee peoples, which asks them to share their territory and protect their land. Subsequently, settlers and newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. I'm grateful for and accept this invitation in that same spirit. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? All right, seeing none, we're going to go on to our first item on the agenda, and we have a presentation. The item is Ontario Seniors Dental Care Program Implementation Status within Waterloo Region, and it's a good news story. And I'm going to call on Grace Birmingham to introduce it.
Great, and good morning, Chair Clark and members of Community Services Committee. I am pleased to introduce Kirsten Barber, Acting Manager for the Dental Program in Public Health, along with welcoming Rosslyn Bentley, Executive Director from Woolwich Community Health Centre. Today, they will present information on the Ontario Seniors Dental Care Program in Waterloo Region, including the expansion of that program into Wellesley Township. Oral health is very much connected to a person's overall physical health and their quality of life. An expansion of this program will have an important and significant positive impact on our residents. And now I'm happy to invite Kirsten and Rosslyn to provide more information and give a brief update.
Thank you, Grace. Good morning, Chair Clark and members of Community Service Committee. I'm just trying to share my screen here. Okay. So this morning, I am quite excited to be sharing a brief presentation with you on the Ontario Seniors Dental Care Program in Waterloo Region. I will touch on some information about the program itself, as well as how residents can access services within the region. This presentation, as Grace mentioned, will also provide some information on our plans for expansion in partnership with Woolwich Community Health Centre. The Ontario Seniors Dental Care Program is a program that provides free dental care for low-income seniors. An eligible senior would be 65 years of age or older and have an annual income of $22,200 for a single person, or a combined net annual income of $37,100 for a couple, and have no access to any other dental benefits, including private insurance or other government programs. Services are currently being provided in partnership with Kitchener Downtown Community Health Centre and Lang's Community Health Centre. And those services include dental checkups, cleanings, x-rays, repairing broken teeth and cavities, treatments for gum disease, treatments for pain and infections, oral surgery to remove teeth or abnormal tissues, and partial or complete dentures. And this program is funded 100% by the Ministry of Health for both operational and capital expenses. Both Langs Community Health Centre and Kitchener Downtown Community Health Centre have 2 fully equipped dental treatment rooms, a panoramic x-ray unit, waiting area, sterilization and equipment rooms, as well as office space and storage. Both locations are now operating at full capacity, both with 1 dentist, a registered dental hygienist, a clinical dental assistant, and an administrative dental assistant. The current demand for this program is quite significant, with both sites having to place eligible seniors onto wait lists in order to access routine dental care. Kitchener Downtown Community Health Centre has a wait list of 575 eligible seniors, and Langs Community Health Centre has a wait list of 392 eligible seniors waiting to access routine care. This results in an average wait time of about 10 months from the time a senior calls to be placed on a wait list until they are able to access their initial appointment for routine care. In order to improve ease of access to services for eligible seniors, a central intake program has been developed within the Waterloo Region. And this program aims to create 1 regional wait list so clients can access the earliest available appointment instead of having to call at each site to get onto separate wait lists. This will improve ease of access to services for eligible seniors. It will support triaging of patients with more urgent needs, and it will reduce the administrative load on the community health centers related to general inquiries. The central intake program has been developed to be able to expand to include the new Wellesley site, which you'll hear a little bit more about in a couple slides. As previously mentioned, the program is 100% provincially funded. Capital funding thus far includes $251,000 for Langs Community Health Centre and $170,000 at Kitchener Downtown Community Health Centre. Both of those capital projects involved expansion on existing dental infrastructure, and the newest clinic in partnership with Woolwich Community Health Centre, which will be located in Wellesley, has been approved at $580,000, and that will be a new build. The annual operating budget was recently increased. So originally the budget was $1.66 million. And in May of this year, the program was awarded an additional $294,000, bringing the annual operating budget to $1,954,000. The operating budget supports all regional Ontario Seniors Dental Care Program sites with staffing costs and salaries, dental materials, supplies and equipment, administrative needs and technologies, rent, payments to community partners such as oral surgeons and denturists, developing and operating the central intake program, as well as supporting the planning and implementation of the new expansion into Wellesley. And I'm now going to welcome Rosslyn Bentley to speak on the rural strategy for expansion into Wellesley.
Thank you so much. So I'm Rosslyn Bentley, the Executive Director of the Woolwich Community Health Centre, and it's my pleasure to address the committee. Chair Clark, thank you for having me. We are delighted to discuss the rural needs for the low-income seniors dental program. In 2021, a postal code analysis revealed the rural populations have largely not been accessing this very successful provincial program. You can see at this map the clients accessing services by neighbourhood. And at the time of the original proposal, we had identified there were 135 eligible seniors within the rural townships of Woolwich, of which there were 40, North Dumfries 35, Wilmot 24, and Wellesley 36. So we've identified the unique barriers that are typical in our rural Waterloo townships: longer travel times to access, the mode of transportation. Many people are horse and buggy, or maybe waiting for lifts with people that are in daytime jobs that have long hours in the agricultural industries, for example. OSDCP clinics in many rural populations prefer to stay within their community to receive service. So in developing a response to this opportunity, if we go to the next slide, we have been working closely with the Wellesley Township. I want to thank Mayor Nowak and his staff team for all the support in this development. We have a 3,500 square foot facility in Wellesley that we've been running for 18 years. But this is of an insufficient size, and certainly during COVID, we identified the very significant infection control challenges of being in a retrofitted building. So with the recreational redevelopment proposed and approved in Wellesley Township, we proposed a new clinic, health clinic attached to the recreational centre, as you can see from this plan. And when the opportunity to reapply for capital funding for the dental programme became available in November last year, we suggested expanding the envelope of the building to include a suite for the dental services. And as you can see, this good news story today is that we have that opportunity. So you can see within the envelope of the clinic, we have a dental operatory, a sterile room that is adjacent and large enough to include reprocessing and all the supports and supplies required for dentistry. And then we have designed a shared workroom that would be available for staff to work in an office setting as necessary. Again, the lessons of COVID has been just how flexible one needs to be to work virtually and mobilely. And we know from other rural communities how essential having this kind of facility would be. So it's a demonstration of the importance of the hub and spoke model that would be effective for bringing rural services. We will continue to work with our colleagues at our neighbouring CHCs. So we already work together on many health and social supports together, but this dental service in particular will be a real advantage to the rural community. And we'll certainly look to our neighbours in Huron-Perth as well. One of the real advantages of this programme across the province is that patients are able to access whichever service they would like to. There is no geographic boundaries, so there is the potential for us to be supporting the broader community with this initiative. Thank you.
Thank you, Rosslyn. And thank you, committee, for listening in, and we're happy to answer any questions that you may have at this time.
Thank you for the presentation. That was great. I especially like seeing the floor plan. For some reason, that helped me visualize what this program is. That's very exciting. Any questions from councillors of staff? And Dr. Wong is also available to answer. Councillor Novak.
No questions. I just want to, express our appreciation on the part of the township for being able to host this opportunity in Wellesley, and we're looking forward. We're looking forward to the opening, which is about 1.5 years away. So it's going to be great for the community. It's going to be great for the rural area. Throughout. So thank you very much for the great presentation, and I look forward to continue working with you, Rosslyn.
Councillor Shantz.
Yeah, thank you. Yeah, great to continue the partnership between Woolwich and Wellesley for healthcare. That's wonderful. My question is a little more about funding. And Rosslyn, you referenced that there are no geographical boundaries for this. And is that reflected in the way it's funded?
Yes, I'm sure the Public Health can elucidate, but it's my understanding that this was a provincial initiative as an election promise in the last Ford election, and committed that clients that were eligible could choose where to receive service. So once the eligibility is determined, they can apply. Now, there are fairly long wait lists in some communities, Langs in Cambridge, for example, particularly. So one of the things that we would hope is that we can redistribute some of those clients throughout the region and serve more equitably from the waiting time point of view. And we have seen demand into the more rural areas tends to be fairly localized, as you can imagine.
So if I can ask one more question, is the wait list that we have just for the region, or because you referenced, I think it was Perth as well. So if the access is provincial, are we just managing our own wait list, or how does that work?
Thank you. And
thanks, Kirsten.
thanks, Rosslyn. And through the chair, I can answer that. We do have a wait list for regional eligible seniors. Anybody who is accessing services from outside of the region is included within our wait list, and it is for routine services. So we are still assisting in emergency appointments for seniors who are from out of the region if needed, if they're unable to access their local Ontario Seniors Dental Care clinics. We will see them on a priority basis for emergency and urgent needs. However, if they are waiting to access routine care, they are still placed on the wait list along with our regional residents.
Okay, thank you.
Councillor Erb.
Thanks, Chair Park. This is a great opportunity for Wellesley. Congratulations. I'm glad it's been able to work out. I'm curious, will anything remain functional in the current health center in downtown Wellesley? Will things still be happening there, or will that be vacated?
So we currently lease that building, so we would intend to vacate that building, and we have notified the landlord at this point. I have already heard from other healthcare providers that might be interested in leasing the building themselves, but there wouldn't be anything left from the community health centre. We would be moving all of our services to the new facility.
Okay, just for interest, that building was my great-grandfather's blacksmith shop.
I understand that, and I've seen some wonderful photos of the history of the building. Thank you.
I see no other questions. This report was for information purposes only. Thank you very much, staff, and thank you, Rosslyn, for joining us. That was a nice one to receive. We have no delegations. We have no consent agenda items. We are on to our regular agenda items, and our first item is the funding confirmation for the Canada-wide Early Learning and Childcare Plan, something else we've been looking forward to with some eagerness. And I'm going to call on Barb Cardo, if she's with us, to introduce the report and answer any questions. Hi, Barb.
Good morning. Thank you for having me. And yes, the report indicates that we have received our allocation for 2022, which is prorated from April to the end of December in the amount of $24 million. And the focus of year one for the Canada-wide Early Learning and Childcare Plan is the initial fee reduction of 25% retroactive to April 1st, along with the beginnings of an additional wage enhancement for the lowest paid early childhood educators.
And are you ready for questions, if there are any?
Yes.
I'm not, oh, sorry. Councillor McGarry.
Thank you. I finally found my button in a hurry. Not so. Quick question, Barb. I know that we've read through through the report, but I'm just wondering, for purposes of clarity for some of our young families that may be out there watching today, what will it mean to, let's say, a parent of a child already in care? What would I expect as a parent to see regarding fees and availability of spots?
So for a family who's already in a licensed childcare program, they should ask their childcare provider if they are planning to participate in the program. The Children's Services will be sending out an application to childcare providers early in July, or applications, so that providers can indicate whether they wish to participate or not. If they are planning to participate, the region will provide funding to the childcare provider that will reduce childcare fees retroactive to April 1st by 25%. And those retroactive payments will be delivered from the childcare provider to the parent. For families not in the childcare system yet, we have experienced a significant increase in applications to One List. It has the monthly number of applications has more than doubled. There are now more than 5,000 families in our One List wait list system waiting for childcare space in the next 3 months. So as you can imagine, it's quite difficult for families to be able to access space. That said, I encourage everyone who is interested to get their name into the wait list, because access to a space is dependent on a number of variables, including location, age of child, and what the needs are of the family for care. So there certainly are still some spaces available. How early should we get onto a wait list? Well, at this point in time, I would encourage families, once they find out that they are going to be having a baby, that they get their names onto One List, so that they are at least in a position. Part of the Canada-wide plan is growth, but that is not the focus. And of course, that takes time. But after this first year, there will be an increased focus on growth. We are going to be creating a growth plan together with the province. There will be funding provided to support capital costs for expansion in the nonprofit sector. And so there will be an increase in spaces over time. But obviously that will take some time to get to get to a place where we have enough spaces in the community.
And if I can, Madam Chair, for a follow-up?
Yes.
I'm just wondering if, certainly the 25% backdated to April 1st is very welcome news. Is there a planned reduction next year?
Yes. In 2023, that reduction will be at 50%. It is my understanding that will be built right into the fee structure of childcare programs. So it won't look like a reimbursement, but it will be the actual reduction of fees. And again, operators have to opt into the program. And so if an operator does not opt in, this doesn't apply to families using that program. It will be reduced to 50% in 2023. There will be another reduction in 2024. And by 2025, we will be at what the province described as an average of $10 per day. Actually, for a full fee-paying parent, it will be $12 per day that fees will be reduced to by 2025.
That's good, Councillor McGarry.
That's great. Thanks so much for the information, Barb.
Thank you.
Chair Redmond.
Thank you, Barb. My questions are on the other sort of end of the equation. Can you just talk about the wage enhancement and who will get a raise and what that will look like for people who are providing the childcare?
Yes, thank you. Through you, Madam Chair. That's a really important question, because we know that wages are a significant issue in the early learning and childcare field. And as in many workforces struggling, the early childhood educator workforce is extremely challenged right now. And in fact, in Waterloo Region, we operators have reported that in order to be able to have enough staff in their programs to provide full care, we would need an additional 490 early childhood educators in this community. And the only reason they are not here is because we are unable to attract that group. And a big part of that is low wages. The other issue with low wages is as well turnover as well. And research has shown us that high wages or appropriate wages are correlated with being able to provide high quality child programs, because where wages are low, there's a lot of turnover and less attraction to skilled educators. So just a little opportunity to speak to the importance of supporting increased wages for early childhood educators. Not to mention the workforce is a majority of women, and so this speaks to women being able to fully participate in the workforce and in society. So in year one, so this year, the wage program only impacts the lowest wage earners. And so the program is provided to bring all educators up to at least $18 per hour. In Waterloo Region, our community, our operators have worked very hard, and we've worked very hard together with our operators to not have anybody that low. And as a result, there are only 20 early childhood educators in Waterloo Region who will benefit from this $18 wage floor. In 2023 and beyond, there is a program to increase all educators' wages by $1 per hour per year, up to a cap of $25 per hour. Operators in our community and across the province are indicating that this is not enough and will not attract the workforce that is needed to do this work, and frankly does not reflect the education that early childhood educators are required to have, nor the incredible responsibility of the work of supporting the development of 0 to 4-year-olds at a time in their lives when their brains are most pliable and vulnerable to both negative and positive impacts.
So if I could just be indulged with a comment, Barb, I really appreciate that. They are highly skilled. What they provide, the service they provide, is helping shape the next generation. They are vastly more female than male, so we have to look at that. And I would have to tell you that the Day Nurseries Act and the prescription of the ratios really limit how childcare is provided. So thank you very much for that. This is a historic undervaluing of a very highly skilled, highly regulated, very important service that helps shape our community. So thank you for that.
Thank you.
I'll just add a comment, and it does have to do with the wages. I think that what we know is that even with that maximum cap, even when we get to that stage, the benefit to most staff in our region will be pennies an hour, because most of our staff are already at that level. So I think providers were pretty thrilled about the fee reductions and the potential for growth in the system. Very let down about the wage enhancement generally, because it certainly wasn't anything like what was being asked for and recommended.
Thank you, Councillor.
I see no other questions. There are a couple of recommendations in the report. And if I can have a mover and a seconder, we can go to the vote. Moved by Councillor Foxton, seconded by Councillor Jowett. Please use your buttons to indicate yes or no. And I believe that's passed unanimously. Thank you. Our next item is Equity and Reconciliation Investment and Initiative Update. And I believe we have Fazia Beg here to speak to that. Oh, hi, Fazia. Over to you.
Thank you. Good morning, Chair and members of Council. In December 2020, Region of Waterloo Council approved a historic investment fund dedicated to improving the social and economic health and well-being of Indigenous, Black, racialized, and other communities disproportionately affected by systemic inequality. This is a regional fund committed to impactful system-level change. The commitment was $5 million for 2021 and $10 million for 2022 and beyond. This has been fully committed to support equity initiatives through a combination of base and one-time programs. What we've learned is that creating community change in this way is only possible when principles of equity and community are at the core of the work. If you want to see different outcomes than in the past, then we must do things differently in the present. Equitable change requires knowledge, relationship, willingness to trial and error, and to learn and improve. As staff, we have taken many intentional steps to ensure we are committed to equitable change by building relationships and trust, and by structuring ourselves for success. This includes working alongside community to ensure that as initiatives are funded, they are responding directly to the expressed needs of communities, using research and best practice to ensure that funds are being distributed effectively, and ensuring accountability and transparency. And this approach is starting to bear fruit. Since 2021, staff from across every department, in collaboration with community leaders and organizations, have actioned this incredible opportunity and invested in many services and programs to actively create change in the lives of those who have been disproportionately affected by systemic barriers. We have provided an overview of the key focus areas, initiatives, and funds committed in Appendix A. I'll highlight just a few. In transit, we've expanded the Affordable Transit Pass program to increase the number of residents eligible for ATP discounts. We've heard many times from community leaders how meeting residents' basic needs, including transportation, is critical to the health and well-being, and now this is available to more families and individuals. Housing remains a key concern for many, and another basic need raised by community. An investment of $5 million towards portable rent assistance programs with community-based navigators, affordable housing, and emergency shelter harm reduction supports to provide more person-centered and culturally appropriate services for accessing housing and supports has been made. In terms of health equity, we've learned many lessons through vaccine rollout, especially by working alongside community to provide services in accessible ways. Public Health's mobile team and community outreach programs will continue and build on this work and engage communities to plan and offer and evaluate services in order to continue to build trust, relationships, reduce barriers, and improve quality of life, and impact the social determinants of health. How residents and community experience regional services is really important to us. The Citizen Service Client Experience Project will work to ensure we are applying a lens of accessibility, equity, anti-oppression, anti-racism to improve client experiences across all our programs and services. This work is making a difference. In the appendix, we've highlighted some stories of impact. For example, from the Home Child and Language Mentorship Program, 17 new home caregivers are starting the process to become licensed home child care providers, including a community of Tigrinya-speaking women, which is a first region. Or in the community gardens at Waterloo Regional housing sites that have helped to bring people out of their units, support connections with one another, and build new relationships, and increase food security in low-income earners. And finally, the Portable Rent Assistance Program, where one family shared the following quote: "Monthly rent support is very important to me and my family because it can reduce our financial stress, improve my family dynamics, and better our physical health and mental health." As staff at the region, we have worked with community leaders and partners and listened to community feedback on areas of growth and improvement in the regional services we provide. I think we've done really well, and you can see from the diverse range of regional services initiatives moving forward. But this is really just the start. Community has also consistently voiced the need for community-led change, and this means more representation at decision-making tables and more supports for community to continue to do the great work they're doing. The Community Safety Wellbeing Plan outlines self-determined communities as one of the key areas of focus to achieve well-being identified by communities. Consistent feedback from communities highlights the importance of resourcing community organizations that are traditionally underfunded, but are carrying the burden of providing services and programs to meet community needs. One example of how staff are responding to this need is by implementing a process to provide funds directly to community organizations to build community capacity and collaboration. This is new and emerging and will align with the terms of reference currently being created through community collaboration for the Upstream Fund. I'd like to end with reinforcing that Equity Investment Fund is not just a measure of dollars invested, but also a measure of investment in relationships, trust, and collaboration with communities. Building long-lasting systemic change happens on its own timeline and will continue to evolve as progress is made. We are seeing some of the fruits from the seeds already planted. I encourage us to take a moment and celebrate the journey and look forward to the road ahead alongside community filled with opportunity, hope, and of course, continued learning and growth. Thank you.
Thank you, Fazia. Any questions of council? I don't see any. I appreciate your last couple of, oh, sorry, I'll just finish what I was saying, Councillor, and then come back to you, if that's all right. I appreciate your last couple of comments because I know that, I'm sure I'm not alone in that I've been receiving, questions from the community over the last couple of years of what are we doing, what have we done, why is it taking so long? And I think that this was really helpful to, there are some projects that we've done where we can say, look, we did this and we did that, but more importantly, I think what we're doing is changing the way we do things, and that does take time, and it isn't as easy to quantify in terms of dollars and cents, but at least as important. Thanks for your patience, Councillor Erb.
No problem, Madam Chair. Thanks for this report and the work that's happening. It's groundbreaking work for the region, and it sounds like it's heading in the right direction. Your comment at the end, Fazia, about it's about building up relationships and trust, and you can see that evolving. I'm wondering, how are we going to measure that? Where's the yardstick to measure to see what impact it's having in the community?
Thank you, and through the chair. I think that's a really important consideration and something that we've been thinking about ever since we started vaccine rollout, where we really were working alongside community. And we definitely had dashboards that had numbers and statistics, but we knew that through doing that work, we were building trust and relationships. And how do we measure that? And I think that's something that we're going to continue to work with community on, to find meaningful ways of building relationships and trust and measuring that success. I think in partly, we could look at the ability of the organization to start new initiatives and to work alongside community. I think that the Upstream Fund consultations and other consultations have been going relatively well, and people and community are engaging. So I see that trust being built and the ongoing relationship. But definitely, I think we would want to look more closely at how would we provide more measures of success in that. I think a large part of that will be storytelling. I think this kind of work doesn't necessarily lend itself to just numbers and data, but more qualitative avenues of exploring that. And I think, one of the initiatives that I didn't talk about was a storytelling initiative through the communications department, which will really look at showcasing and telling the story of these equity investments through the lens of the community and the views of the community. So I think that will also speak to some of that trust and relationship building.
Thank you. Yeah, and I appreciate your response, because I think it's really important that the measurement not only takes place at the region end, but also from the community, that they feel heard and take it into the how the program is evolving. So thank you for the work that you're doing. Councillor
Galloway.
Well, thank you, Madam Chair. I just wanted to comment, and really this comes on the tail of attending the Coalition of Muslim Women's event yesterday, the Afzal family vigil, and the Islamophobia study that Sarah Shafiq did, and certainly her work and the research that she showed yesterday certainly shows the need for this kind of these kinds of efforts in the community, particularly as it pertains to Islamophobia in this case. Although there was references in her report as well to other racism problems that we have, but I was also very pleased to hear that I believe we helped fund that particular report. So that's the kind of work that in part at least that we're doing, and I know there was a lot of appreciation for that yesterday for what Sarah had done and the recognition that the region got. So it's just an example of one really practical way that we're putting that money to good use.
Thank you.
Thank you, staff. I don't see any other questions. That was for information purposes. There's no vote. We are now going to go on to the Paramedic Services Update Report, something that we've been signaling for the last couple of meetings, and I know you're all eagerly awaiting. And Chief Van Valkenburg is going to provide a presentation and answer any questions.
Thank you, Madam Chair, and through you, we'll get the presentation up. Good morning, councillors. I'm here today to present a follow-up report to the May 25th PHE-PSV 01 report, which was our performance report. And we're doing this report or this presentation in tandem with finance. So as we discussed in the last report, next slide, please. Volume and service level indicators in paramedic services. Our call volumes in 2021 showed a 10% increase over 2020. And have continued to grow at a rapid pace in 22 to date. Call volumes are growing at a faster rate than the low growth scenario outlined in the 2019 master plan, with the level of calls now trending along with the high growth scenario. Our unit utilization target benchmark set out in the master plan was 35%. Since 2021, the unit utilization has been steadily increasing. This is in spite of the 3 new 12-hour ambulance shifts that were added in July of 2021 and the 2 new 12-hour ambulance shifts to be added in July of 2022. As of the end of the first quarter of 2022, our unit utilization reached a daily average of 52.3. Next slide. Increased call and vehicle response volumes can be attributed to a number of key factors, but not limited to a growing population. More people result in more calls. Waterloo Region is one of the fastest growing communities in the country. Provincial data expects the region's population to reach 923,000 by 2051. An aging population, generally older individuals require the service more. The numbers of residents aged 75 and over is expected to increase by 169% over the next 2 decades. Next slide. So Paramedic Services has the following proposal and recommendations. Staff recommend additional resources in 2022 and 2023 in accordance with the updated 2019 Paramedic Services Master Plan to align resourcing with the high growth scenario based on our year-end performance, PHE-PSV 22-01, report and presentation that we gave on May 10th, 2022. This will help ensure that ambulances are readily available to respond efficiently to our raising 911 call volume and unit utilization. Staff recommend the addition of 55 paramedic FTE positions and a total of 10.8 supervisor and support FTE positions in 3 phases: the fall of 2022, spring of 2023, and the fall of 2023, along with 8 additional ambulances and 1 emergency response unit. I'll now over to Mr. Dyer to discuss the financial portion of this report.
So through you, Madam Chair, just briefly, in the report, we have taken our usual approach to financial implications, which is to provide a summary of the operating and capital budget implications, as well as a table of staff complement requirements. And so I've basically reproduced those three tables here, starting with the operating budget side. So further to the Chief's comments, so a phased approach over this fall into next fall. On an annualized basis, this is approximately a $10 million annual investment, which you'll see on that total ongoing expenditure line about midway through the table. From a funding perspective, we've taken a similar approach to what we have recommended over the last several budget years where additional paramedic services resources were added. And that is to fund the provincial portion, because the provincial portion, as you'll recall, always lags by 1 year. So we would use the tax stabilization reserve to essentially phase in the provincial funding. So in this case, by the time we got to 2025, we would have the fully annualized expenditure as well as the provincial subsidy reflected at 50%. So we have made the assumption that the province will continue its practice of funding ambulance operating costs at a 50% level. And you can see that through the provincial subsidy line here. From a levy impact, it's approximately $3.2 million in 2023 and $1.7 million in 2024, adding up to the approximate $5 million. On the next slide, you can see the staffing implications. So in total, 55 paramedics added with supervisory and logistics and support positions. In total, it's just under 66 FTEs, which would be added in a phased approach over 2022 and 2023. And then on the final slide, with respect to the capital program, capital costs reflect the need for additional ambulances, as well as the equipment for those ambulances and one emergency response unit. Based on the supply chain and delivery challenges with respect to ambulances, even with an order being made this month, it's highly unlikely that we would have any of those vehicles arrive in 2022. And so what we've proposed is to show the additional ambulances as a 2023 item. I think we're optimistic, maybe hopeful that we'll receive them by the end of 2023. We're confident that the ERU would be delivered in 2022, so that would be added to the 2022 capital program. And then the only complication from a funding perspective is that a portion of the capital costs for paramedic services are eligible for DC funding, development charge funding rather. We have pretty much maxed out that funding under our current bylaw. So what we would propose is to fund the acquisition, which in total it's about $3.8 million. We would fund the acquisition from existing reserves and then build in a payback of the development charge component over the next 5 years of the development charge bylaw that will come into effect in 2024. So just a little bit of creativity needed to make the funding work for those vehicles, as shown on the slide before you. And Madam Chair, happy to answer any questions on the financials.
Thank you, Mr. Dyer. And I cannot see the questions because the screen... I'll start with Councillor Shantz because she's the one whose hand I can see. Go ahead.
Thank you. I'm just flipping through here. We're looking at the increase, and I can't find what kind of percentage that is over our current costs. Is there some kind of if that number is in here, I can't see it. Can you?
I'm not sure whether that's a dollar increase, which you would get from Mr. Dyer, or a staffing increase, which we would get from Chief Falkenberg, but whoever wants to talk first can.
Not just the increase, but the percentage.
Yes.
I'm just wondering how much of an increase is this over our current budget? And I'm sorry that I can't see that.
Through you, Madam Chair. Yes, you can't see it because the number is not there. We'll calculate it and we'll send it to you.
Thank you. Good to know.
Councillor Galloway.
Thank you, Madam Chair. Well, I think Chief Van Valkenburg will know what my question is likely to be. So I know that this doesn't really deal with the increased call volume, but our response times, of course, do play into how many, what our resources are. And I'm wondering if the chief can apprise us of where the dispatch situation is in terms of the possibility of Waterloo Region being involved in the same kind of dispatch system as Niagara.
And through the chair, thanks for the question, Councillor Galloway. And unfortunately, the ministry has been completely silent even before the writ was dropped about dispatch. So there doesn't seem to be any movement about that. What I can update you with, which is, I guess, good news, is that they are moving forward with the new triage system into the Mississauga Dispatch Center, and they're going to go live in November with that. And I've been heavily involved in doing the provincial policy and the deployment plans for that. So I'm happy to say that that's moving forward, which is a nice change. But in terms of any announcement from the government about downloading of dispatch centers, there's been absolute silence on that. So I really couldn't say with any certainty that that is even still a possibility at this particular point. I think we just continue to advocate to the province for that, as we have been doing.
Okay, well, I didn't expect anything different, but it's, I think, 5 or more years now that we've been hoping for that change, which from what I understand, could have a fairly dramatic improvement to our response times, which then kind of trickles down into the number of resources that you need. I'm just wondering, the initiative that you referred to with Mississauga, and if that were to be rolled out, what improvements does that actually provide, Chief?
Right, and through the chair. So that particular is the rolling out of the medical priority dispatch system, the MPDS, that I've spoken to over the years. And that's the new triage system that's going to be housed in the dispatch center. And it's a very specific triage system, much better than the one we currently use. And it's actually able to retain our resources to respond to those emergency calls better than the current triage system. So that, in conjunction with some of the things that you're looking for about having direct control of the dispatch center and being able to do certain things, that's just one of the tools in the tool chest for paramedic services to actually make sure that they have available resources through the use of the MPDS, of the triage tool that they're rolling out. We're scheduled right now about 3 years out from that particular triage system being in our Cambridge Dispatch Center, according to the plans.
Okay, thanks, Madam Chair.
Chair Edmund.
Thank you, Chair Clark. I think my question is probably for Craig, and it may be more a statement than a question, but I really do appreciate the fact that staff is stepping up during what is a tough budget year and a necessary investment in a service that the community values. Having said that, I sit on some task force through AMO, and I know that development charges are in the crosshairs of the province, and it's one of the tools that they look at in increasing housing and whether or not development charges would continue to be charged. So I appreciate the fact that this will come out of the tax stabilization fund and reimburse the development charge fund, for lack of a better term, but I do worry, and I guess I would just like to flag for colleagues that it's a huge issue for growth, paying for growth, and I worry that it may be one of the things that the province looks at as a tool to continue to increase development of housing. So just a caution that we need to safeguard the fact that those development charges still play a very important role in creating infrastructure for us. Craig, I don't know if you want to comment on that.
Well, through you, Madam Chair, just to say that I share your concern.
Councillor McGarry.
Thank you, Madam Chair, and through you, I would say that Chair Redmond asked a lot of my questions. And on that same thread, I'm wondering if there's other jurisdictions that have found themselves short of paramedics, short of ambulances, are experiencing high offload delays in the province that are also asking some of these similar questions regarding development charges and how we're going to actually properly fund, or I guess more fully fund, ambulances and paramedics in the light of our increasing population?
And through the chair, so thanks for the question, Catherine, or Mayor McGarry. Yeah, every service in the province has actually been experiencing issues, whether that's with call volume, whether it's offload delay, and certainly with budgetary issues. That's pretty universal across the province. I know that Hamilton, for example, just took a master plan that they just created, and I think they're adding 5 ambulances, 5 12-hour ambulances every year for the next 10 years, according to their plan. So there is issues. Definitely response times in municipalities are going up. And that's a combination of population growth, number of resources, offload delay, unit utilizations. There's all sorts of, but yeah, we're certainly not unique in this particular issue. We certainly are, I'd say, somewhat more challenged than some of the other services, but they're all experiencing similar issues.
If I may, as a follow-up, Madam Chair, I would say that, again, this would be something that all of us can take to not just AMO, but some of the other organizations that we sit on, especially if there's some issues across the province, and I would say there is. I mean, that's one of the, I guess, the side effects, if you will, of the steady growth that we're seeing, and the fact that we're one of the top municipalities that is experiencing growth, not just through Ontario, but through Canada. But do you think that, you know, in your opinion, is there a better way that we can fund the service itself? You know, is there a policy change that we may be able to sort of try and endorse or push for at the provincial level to ensure that we don't experience these kinds of delays and shortages in the future?
So through the chair, I can't speak too much to the funding side of that unless they change the funding formula from 50-50 to something else to get more money out of the provincial government. Mr. Dyer might be able to speak a bit more on that. The advocacy piece, I think, is quite important, and you bring up a good point about going through AMO and all these different associations. And the Ontario Association of Paramedic Chiefs continues to have audience with the government, and they'll be waiting for the new government to form because there's a few things that they have on their table that they wish to discuss with that particular government as well. One of the big things, for example, is the offload delay issue. We were going to be publishing from the OAPC a document on offload delay, pushing back on the government, saying this is a healthcare issue. This is not a municipal issue. This is not something that municipalities or paramedic services can fix. So they need to step up to the table and address that particular issue. But I have no way to raise income or revenue from a paramedic service given the current legislation, unfortunately.
Thank you. We'll take that under advisement, and I'm sure there will be some expanded discussions amongst our colleagues across the province. Thank you for the work that you do, and thank you for the work that the paramedics do. It's essential to our community, and I think the community is much more aware of it now, post-pandemic. I'm going to say post-pandemic, but anyway.
Thank you, Councillor.
Councillor Bentley.
Thanks very much, Chair Clark, and thanks, Mr. Van Valkenburg, for your presentation and subsequent questions. I guess, you know, just building on some of those questions, you know, I know we're continually working and dialoguing with colleagues across the province, looking at best practices, seeing how we can apply them here, particularly in things like offload delay and so on. But I'm just wondering if we've sort of looked at any other approaches across Canada or even across North America, and recognizing we operate in a bit of a different framework here. Are there some things that potentially we could or should be looking at that might help us in terms of addressing some of the pressures that we're feeling, and or open the door for some other things we should be advocating for?
Through the chair, thank you, Councillor Paramedic. Yes, so there are a few things that are simmering in the background. One, first of all, as I spoken of about the medical priority dispatch, that we'll have an ability to have some input into how we dispatch our vehicles when they do implement that. So that's one initiative. Some of the other things that I've spoken about in the past as well is the community paramedicine program, and that's starting to gain some real strength, and we'll see sort of what foothold we can get within the community and how we can assist healthcare agencies and stakeholders to try and get folks to be diverted away from emergency department, being treated in their home. So there'll be some economy in that piece as well. There's also the change that was made to the legislation about the alternate destination treat and release programs as well, and we'll be looking at those. The big piece of that though is that they're great programs, and we'll look into them, but they're not going to be high number programs, and it's still tying up a resource as you treat and refer or treat and release these folks as well. So that's one of the areas that we can certainly look at, and I think we'll continue our vigilance on paramedic services, both nationally, internationally, and even provincially, to see what other types of programs they're doing to divert patients and center on the 911 system as we know it, which is causing most of the concern right now in our growth.
Yeah, I know, you referenced the community paramedicine program, and, from what I've been able to learn about it and hear from your staff, it's an outstanding initiative, and certainly, can help us, I think, a little bit. But in fact, the big benefit will be in terms of hospital and healthcare budgets if those folks aren't in the hospital system. So somehow we're going to need to make sure that if we're taking that on, while it results in better outcomes for individuals, which is obviously our first priority, it doesn't necessarily help us in terms of managing our costs if there isn't some sort of sharing happening with the hospitals, and that probably is going to require some policy advocacy going forward. So keep us in the loop on that, and let us know how we can help in that regard. And Madam Chair, if nobody's moved this yet, I'm certainly be prepared to do that and just comment very briefly. I'm very pleased to see this report back, as Chair Redmond has indicated. I mean, we are looking at a challenging budget year in 2023, but we know this is a significant of concern in the community, and one that we want to make sure we're, as a growing community, providing a level of response that serves the needs of our residents at a time that often is very critical for them, and where they're really looking for government to deliver on the services that are necessary. So I want to thank Mr. Van Valkenburg for bringing the report back, and for looking at ways how we can gently as possible, I guess, introduce this into the budget stream over the next several years. Thank you.
Thank you, Councillor Babanich, and Mr. Dyer can correct me if I'm wrong, but I believe the budget presentation we had this morning did assume these increases.
Yes, that's correct.
Thank you. Councillor Foxton.
Thank you, and through you, Chair. To all of us, many of us watched the coming down of the provincial budget before election, and I know we're all still curious as to whether it will be a real budget or not, because in it did provide an offload service. It did provide an area in each hospital that would have ambulances offload to staff, not to ambulance staff, but to nursing staff. So that's something we should be really watching and actually trying to push, especially maybe at AMO before they come down with the budget. I think they'll come down in September, to watch that that's not missed, because that would make a tremendous impact on our ambulance service.
Councillor Shantz?
Thank you. Yeah, I've always had a thing about offload delays, so hopefully they can come to terms with that. But my comment, and I'm not looking for an answer right now, but just as we do our advocacy, I think, I mean, we're trying to break down silos here at the region, but the province hasn't done that yet. So I think it would be a good exercise to split out the costs that we are saving for healthcare that is still a provincial responsibility from our own responsibility. And not that I think we should focus there as a region. I like that we're breaking down silos, but I think in terms of advocating to the province, it would be important to show those pieces.
All right, thank you for that. Councillor McGarry.
Thank you, Chair Clark. I just wanted to briefly make a comment that it's an integrated healthcare system, as we know, and part of the issue with an offload delay is, of course, ambulances having to wait until they could offload to a trained personnel, and it's usually a registered nurse in those circumstances. I know that the program that was previously rolled out had some issues. There's such a shortage of nursing staff across the province, which has been unprecedented this year compared to even a few years back when this program was tried. And from my experience, when there was a shortage of personnel in the emergency departments, the nurses that were assigned to offload delay stretchers were actually drawn back into the department to manage the rest of the emerge department. So an offload delay and trying to get staff to be able to staff that program would need a significant investment by the province at this point to attract and retain nurses. We've got a critical shortage, as we know, not just here in Waterloo Region, but across the province. Thanks for your indulgence.
Thanks for the reminder about how interconnected all this is. And Councillor Foxton.
Thank you. Just Craig Darris just sent us all an email on those figures. So Craig, what you're saying, it would be a 20% increase in 2022. That means a 20% increase in expenditures, but not increase in tax dollars, correct? Really, Craig?
Mr. Dyer?
Yes, thank you, Madam Chair. And perhaps I could just ask for the operating budget slide to come back up, just to make sure we're all clear. The 20% that I referred to is not in 2022, first of all. So this is the annualized impact, and I think it's slide 5, I would say. Right there. Perfect. So you can see, so in 2022, we're based on the number of paramedics that would be brought on board later this year, we're anticipating in-year costs of just over $700,000. Those costs would be funded through the tax stabilization reserve. And that's because of the lag in provincial funding. So the 20% that I calculated is based on annualized, fully implemented costs of about $10 million, which you'll see in the 2024 and 2025 columns, and taking that $10 million as a percentage of the 2022 approved operating budget for paramedic services, which is just under $50 million. So that's where the 20% comes from. The tax levy impact is phased in essentially over 3 years, 22, 23, 24. By the time we get to the 2024 budget, we have all of the tax levy funding in place that we need. We need one more year after that to get the provincial funding in place. I hope that's helpful.
Thank you. Yeah, it's just the email just said, 10 million, which represents approximately 20% increase over the 2022 approved operating expenditure budget. Similarly, the FTE increase represents a 22% increase over the 2022 budgeted levels. But yeah, I understand what you're saying.
I'm going to go to Councillor Shantz, and then I'm going to ask for a seconder and call the vote. Councillor Shantz.
Thank you to Craig. So 20% increase in costs. We're looking at, I guess our population increase is over 30 years, but we're looking at a 50% increase in population over the 30 years. So just looking at the increase in population plus the increase in the aging population sort of puts it in perspective as quite a reasonable ask.
Thanks. And yes, this isn't something we should be expecting to hold steady. Do I have a seconder for the 4 recommendations, Councillor Lorentz? And please use your buttons to vote. Councillor Banovich, is that a button or is it a... I believe... Sorry. It's carried, and I believe that's unanimous. Thank you very much. Good conversation. These agenda items are not getting easier as we work our way through the agenda. Sorry about that. I'll speak to staff about starting hard and getting easier next time. I am going to call on Ryan Petitpierre to present a presentation on unsheltered homelessness and encampment response.
Thank you, Madam Chair, and through you, just bear with me while I share my screen. Thank you, and good morning, Regional Council. The region of Waterloo is working towards an ambitious goal of a world-class community for all of our residents. Integral to this cross-departmental objective is a commitment to making housing affordable for all, because we believe that communities thrive when everyone has a place to call home. And this vision is so much more than words to the staff team here at the region, where we try every day to put the people we are privileged to serve at the center of everything that we do. We also recognize the centrality of home and community in creating a better life. We know that as a social determinant of health, housing is really foundational to promoting a healthy and thriving community for all. Ending homelessness in all of its forms for every single person that lives in Waterloo Region is crucial to realizing this vision. This knowledge informs and guides our every decision, investment, and action. And increasingly, we must make difficult decisions about what the journey to realizing this vision looks like. Decisions like how to prioritize scarce funding resources or how to respond to the consequences of an income support system that excludes so many from our rental housing market. These decisions are not taken lightly, but they are decisions that are always made with the human being at the core. Homelessness continues to grow across Ontario, across the country, and across the globe. This growth started before the pandemic and has escalated through the last several years. And that work continues to be challenging despite the relentless focus of staff, of council, of area municipalities, of service providers, and community partners. And that continues to grow through several large forces and systemic factors that complicate and add to that challenge. Factors that include, amongst others, inadequate social assistance rates, housing affordability and rental vacancy crises, insufficient housing support funding to help people stay housed and recover from homelessness, the increasing complexity of the needs of the people that we serve, enduring systemic oppression impacting community members, including those identifying as African, Black, Indigenous, and racialized, the continuing impacts of the COVID-19 pandemic, and the ever-widening gap in the supply of affordable and supportive housing versus the demand for it. Solutions to the homelessness crisis require additional supports from the federal and provincial governments, as well as a whole of community approach, including additional upstream solutions that address the root causes of homelessness. The region will continue to play a key role in this regard, convening partners from various systems to continue to work on this very complex issue. Not only are we continuing to see and continuing to feel the impacts of growing homelessness, the data also supports this. And I've included a few data points for consideration and reflection on this slide. Chronic homelessness. That is an experience of homelessness of 6 months or longer in the last year, has increased 88% since March of 2020. And that's despite heroic community efforts that saw over 500 individuals housed last year from a situation of homelessness. Our emergency shelters are full or close to full on a regular basis. And that's despite doubling the capacity of that system over the last couple of years. And as homelessness continues to grow in the region, so too have the number of unsheltered individuals in homeless encampments. And finally, the point that took place in the fall of last year identified over 1,000 people experiencing homelessness of one type or another, which is up from just over 300 counted in the same way in 2018. As the provincially designated service manager for housing and homelessness and the federally designated community entity, the region of Waterloo has a critical role in administering programs and services for affordable housing and homelessness. And this work gets carried out with the funding and the guidelines received from these orders of government. And while the gap continues to grow between the resources that are provided and the needs of the local population, the region increasingly looks to the municipal tax base to make up that difference. Community members living unsheltered, for example, need comprehensive health and housing supports to achieve housing stability. And without these adequate supports, communities across Ontario and nationally will continue to struggle to manage these issues. And any resources used to manage this crisis created by the existing gap means that resources get diverted from sustainable longer-term solutions. We continue to focus on ending homelessness through permanent housing solutions while trying to balance the need to offer safe sheltering solutions and other responses to homelessness. Staff and community partners do the best that we can with the knowledge, funding, and resources we have, including responding to unsheltered homelessness and encampments across the region. The consistent response of the region and partners to people staying unsheltered at encampments begins with a notification process. This often comes through municipal bylaw officials, service providers, or community partners. Once notified, a collaborative response is taken by street outreach, area municipal bylaw, police, and other community partners. This response focuses on taking a person-centered, service-first approach of building relationships, identifying and offering individualized services, and providing information and referrals to programs like available emergency shelter spaces. This response aligns with the approach being taken to support the people staying at the encampment on regional lands at 100 Victoria Street North in Kitchener. Balancing the service-first provision to community members while maintaining the use of lands is a focus of the response, as is maintaining the respect and dignity of the individual staying there in all interactions. In connecting and building relationships with the people staying at this encampment, we know that there have been many paths that have led these individuals into homelessness. As of May 30th, there were 53 people connected to this particular encampment. They range in age from 18 to 61 years old. And perhaps most significantly, 1/3 of the people staying at this site began experiencing homelessness during the pandemic. Their heartbreaking stories of job loss, significant health, mental health, or substance use challenges, relationship breakdown, and housing loss highlight the far-reaching and all too common impacts of the pandemic on our society. Their stories are a grim reminder that none of us are immune to these tragic circumstances. None of us are immune to experiencing homelessness. Staff and community partners are committed to continuing to support people connected to this encampment and others through a service-first approach as they relocate from an encampment site. This includes maintaining individualized housing plans and continuing to facilitate ongoing dialogue about housing and support options. The most pressing social problems facing communities today require multi-agency and cross-sector solutions. Since the causes of unsheltered homelessness are many and complex, there is no one-size-fits-all solution in responding to it, and no one organization or government has the necessary resources to solve the problem on their own. Many priority actions show the relentless focus of staff and community partners in implementing system enhancements and sustainable solutions that prevent and end homelessness and that reduce unsheltered homelessness. And I've included a few of those highlights on the slide. Efforts to mitigate the growth of and end homelessness include responding to unsheltered homelessness and encampments. And this in particular is one of the most pressing social challenges that we face as a region, as a province, and as a country coming out of the COVID-19 pandemic. The pandemic has both highlighted for all of us the centrality of home in our lives, while also serving as a reminder that experiencing homelessness can happen to anyone. The region will continue to be a leader, ever mindful of our impacts, of our investments, and the decisions those have on those that we are privileged to serve. We remain focused on investing scarce resources in sustainable solutions, like implementing programs that are proven to link people to permanent housing, and by doing so, end their experience of homelessness. We know that ending homelessness is possible. One investment, one program, one person at a time. We are also committed to drawing attention to the systemic factors causing homelessness and the role of other levels of government in responding. We know, for example, the deep connection between health and housing, and we will continue to advocate to the provincial government for directed and sustained investments in supports for those living with mental health and substance use challenges. We know that without a livable income, so many in our community, including those receiving social assistance, will be unable to afford housing. And as we engage in this important work, our North Star continues to be working towards that world-class community that will not be possible until everyone that lives here has a place to call home. Thanks for listening.
Thanks, Mr. Petitpierre, for a very powerful presentation. I can hear the passion and the frustration and the exhaustion in your voice, and I know that all of your colleagues will share that. I'm sorry as council that we haven't been able to give staff a magic wand, but I do know, and I think we all know, how hard staff are working with the limited resources that you have to bring all of these issues to the best resolution possible. Lots and lots of questions, so I will start with Councillor Jaworski.
Thank you very much. Through the chair, I think what really struck me, Ryan, is the number one, the person-centric approach that you're taking, your team's taking, and the community's taking with this encampment. But it also struck me with respect to Craig's earlier presentation and Chief Van Valkenburg's earlier presentation that where they're having a hard time forecasting the needs of the region. Your team must be certainly experiencing that with the great challenge you're facing. So thank you very much for that. My question is on the details. And when you take a person-centric approach, your team or perhaps the outreach workers are visiting a person in a tent, and you talked about a more personalized approach. I wonder if you could unbundle that a bit more to say, like who is going there? Is it regional staff? Is it the working center outreach workers? And what sort of options might people be given? And I realize that this is hard to do, but maybe just to shed a little bit more light on it and what we might be offering people, because as you mentioned, we are looking for system enhancements to make our shelters more open to all, say people with an animal like a service animal and that. Maybe you could just unbundle a little bit more so we all have that detailed understanding, or at least a flavor for it, please, Ryan.
Through you, Madam Chair, I'll do what I can, Councillor Jaworski, to answer the question. And if I don't get into the details sufficiently enough, I'll call on our Assistant Director, Kellyanne, who can do so much better than I. In starting off to answer your question, key to all of this is relationships between the people that are staying at an encampment and service providers. And that largely occurs through outreach services. Great work done by regionally funded providers for outreach services like One Roof, like the Working Center, like Cambridge Self-Help Food Bank, for example. And their primary role is to connect and form a relationship with everybody that is unsheltered and begin building from that relationship to discuss options that are available to that particular individual based on their circumstances. And as you know, the circumstances are as unique as there are unique individuals staying unsheltered. Referrals to options can be things like income support programs that they may or not already be receiving. Referrals to shelter system based on their circumstances, connection to other housing supports, or even family reconciliation as examples that might be offered based on the individual and based on their individual circumstances. There are other outreach services too that do this work in alignment and coordination. Sanguine comes to mind, for example, as a health-funded service that also has outreach and addiction supports connection amongst the other agencies that I mentioned. If you're looking for additional details, Councillor, I can call on Kellyanne if you like.
No, that is sufficient, Ryan. Complex and complicated at the same time. Thank you very much. I'll turn it back to the chair.
Councillor McGarry.
Thank you, Chair Clark. And through you, I wanted to also acknowledge that having just gotten back from the Federation of Canadian Municipality Conferences, that these issues are not just experienced here in the region or the province, it's literally across Canada. I think that the other thing that I wanted to acknowledge is the word frustration, and that doesn't even cut to the chase of or the core of what everyone's experiencing. Those providers, our staff here at the region, but also area municipalities. We've been looked to for a long time to resolve this issue with, again, that magic wand nobody has, but it is incredibly frustrating. I think that this is the time when we look at our province and recognize that paying for social services through our property taxes is absolutely not sustainable. It goes along with some of the discussion that we had earlier in the Audit and Finance Committee. And I think this is the time where challenged municipalities need to demand a better deal on how we pay for these issues at the upper levels of government, which is where the funding should come from. We just don't have enough resources in our community. We also are continuing to focus our resources on the root causes of homelessness, which are many and complex, and it demands investment really across the board. And we're seeing that in some of the budget impacts that we see this morning. But I think I just wanted to say that I'm concerned sometimes that area municipalities who are also dealing with this are not at the table where everybody should be. There are sometimes some of our service providers that are being called to meetings, and the area municipalities are not there to weigh in when indeed, you know, these residents are actually in our community. So I'm just wondering how we go forward with this. It's hard to unpack each and every issue, but wondering in going forward how we can involve the area municipalities more fully in some of these discussions.
Councillor McGarry, is that a question for staff or for council?
Yes, for staff.
I know that staff. Oh, I'm sorry, Mr. Lochner, I'd like to speak. I know that those conversations are happening at all of the different tables, but perhaps Mr. Lochner can speak to that.
Yeah, it's a great question, and I know Ryan can add more. So we have the regular regional and area municipality housing and homelessness meeting, which includes the CAOs and other staff from the area municipalities. I attend that meeting regularly, and I find it quite productive. And to your point, Councillor McGarry, very specific and unique issues, although it's common across the country. Last night, we had a meeting, and quite privileged to meet with our health providers, our mental health providers, outreach, shelters, social services, and so on. And Ryan, Peter Sweeney, and I were able to attend because this is a whole of community issue, and we need to support our vulnerable residents across all sectors. So that meeting last night was specific to a request from the BIA and downtown businesses, but we did say, and all the sectors, all the providers said, you know, this is a region-wide issue, and this is just yet another conversation in a series of conversations. So we will be having similar conversations in Cambridge with the wide range of providers there, in Waterloo and the townships and so on. And it feels, as we come out of COVID, back to the region that I remember, where we're able to get together on these big issues. And despite people being exhausted, I saw hope yesterday in that meeting once again.
Thank you. And if I could follow up, Madam Chair, I appreciate that. I understand that, you know, certainly areas have issues. Our BIA in the downtown Cambridge area has been requesting resources and meetings like this for years, and we've had targeted response sometimes. But again, we all know that this is a region-wide issue. And so when people leave one encampment, they will often travel, or sometimes do travel, to other areas in the municipality because there's just no single fix for this. I understand that, but I do believe that I feel that Cambridge has been shortchanged to some extent. It's no one's fault, but we've been asking for these kinds of targeted meetings for years, and we're often left in the dark except at the last. So I'm just going to note that I'm concerned about that. I think last night our downtown BIAs may have been invited, since we did have resources from Cambridge at the table and service providers. And I'm quite concerned that as we move ahead with any encampment that may impact our area municipalities, that we weren't at the table. So I know these discussions will be ongoing. I wish I had that magic bullet solution, but I think this is a message to each and every one of us that we need to continue to focus on how we as individuals, as cities, as townships, can actually support people to prevent some of the mental health and addiction areas or health issues that we see in our population. And the message of kindness to all can't be underestimated. And I know you all know that, but I'll get off my soapbox now. But thanks for that involvement and look forward to a future meeting.
Councillor Paramedic.
Thanks very much, Chair Clark, and thank you to Ryan for the presentation and the work that staff from Bruce on down, through housing and many other areas have been working on this issue. And I do want to begin by just echoing the comments of Councillor McGarry, having just come back from FCM and also speaking with my big city mayor colleagues. I mean, the issue, it's particularly an urban issue being faced in our larger urban centers across Canada, but in fact also in other cities as well. But it's the urban centers that are dealing with it in the most significant ways. And it's without a doubt creating challenges as we strike the balance that's necessary in serving these vulnerable residents and meet the needs of the rest of the community. I guess I have a whole series of questions, but I'll maybe limit myself just to the first few now and come back because I see there are a number of other people in the queue. But just going back to your presentation, Ryan, I'm just wondering if you can remind us, as part of our philosophy, has the region bought into and adopted housing as a human right framework in the work that we do? Because I don't recall that we have. But I'm wondering if you can remind us to that effect, and if we haven't, should we in fact be looking to do that?
Through you, Madam Chair, in my time at the region, nothing has been put forward and endorsed by regional councils supporting housing as a human right. What we have had supported and endorsed through regional council is a housing first philosophy, but it hasn't taken the step, to my knowledge, of endorsing housing as a human right. So that is something that we could look at doing if so directed.
Would that change anything from your perspective? If we did do that?
Through you, Madam Chair, I think the work that we do and the philosophical underpinnings of how we undertake that as a staff group, no. I think that what it would have some clout in is in terms of advocacy efforts and endorsing a position that would be speaking the language that would get the attention of some of the provincial and federal government initiatives that have been mentioned here today. I think it's a starting point, and certainly something that, speaking on behalf of housing services, we certainly would support it. It is how we operate currently in terms of the work that we do.
Okay, thanks for that, and I'll give that some further thought. But my next question is just in terms of yesterday, I know regional staff took some action with respect to the issue of the encampment at Victoria and Weber. And you know, one of the things that you talked about in your presentation is the importance of partnerships and collaboration. But we heard on social media and in other places concern from some of the partners that we referenced, even on the signage and so on, like Sanguine and the Working Center and others, about the fact that they felt not engaged in the process. I'm just really wanting to better understand that and how you know, what happened there and what do we need to do to sort of correct some of that?
Mr. Lochner? Okay, go ahead, Mr. Petitpierre.
Sure, and through you, Madam Chair, maybe I'll begin. What I can say is our partners at the Working Centre and Sanguine have been engaged over the last few months at an operational level for sure. And we've looked to them for their expertise in creating and facilitating the relationships with the individuals at the site. The signage provided at the site was in reference to additional supports that would be available, wanting to, again, make sure from a human level, the people at the site had some options on who to go to and who to talk to should they have questions about what's happening specifically. And knowing that the Working Centre in Sanguine had spent a lot of time building those relationships, that seemed appropriate. We have heard from our that has conflated the notice to vacate the site with them as organizations, and we're working to correct that now. In terms of the decision to provide notice and the timing of who was informed of that, that was largely communicated Monday morning in real time to the partners. Bruce, happy to defer to you if there are additional pieces that you wanted to speak on with the timing.
No, that sounds good.
Okay, and my last question, you know, I know as this encampment unfolded over a period of weeks, there were certainly, you know, many, myself included, who argued that, you know, we can't let this grow because it's going to get to a point where it becomes a challenge. And now we're obviously dealing with it. One of my main concerns, whether we use the housing as a human right philosophy or, you know, the housing first philosophy, is the concern that there are viable options for these individuals as they relocate off this site. There's no question that there are issues and concerns. You know, I'm certainly hearing them in the neighborhood, from businesses, from the neighborhood, the city councilors are, the BIA is. But I also believe that it's fundamentally important that we have viable alternatives. And so I'm wondering if you can just go into a little more detail around the work that regional staff are doing to ensure that we have viable alternatives for these individuals. Because that is going to be key from my point of view, and not so that we don't just simply see them relocating elsewhere.
Through you, Madam Chair, I think I'll go back to part of my presentation, Councillor, and that the options that we are able to provide these individuals, not just at 100 Vic, but elsewhere across the region that are unsheltered, are within the resources that we currently have available to us. By and large, that would look like a referral to emergency shelter for individuals that would be willing and able to accept that, or reconnection and support to whatever their individual circumstances or desires would look like. Part of the paths that have led individuals to this current site are because this is the option that they had available to them. I think that in offering and continuing to offer and working with everybody on an individualized basis over the rest of this month, we will try to the best of our resources and abilities to resolve the situation for everyone. I do not I am not entirely sure that that will work for everyone at this particular site, and that continuing to live unsheltered will be an option that some of these individuals currently staying at the sites will take.
Okay, thank you for that. I'll leave it for now. I do have some more questions, but I'll come back after others have had a chance to speak, because I do think there's some more follow-up on that and other issues that still needs to be discussed. Thank you.
Thanks, Councillor Urbanovich. I'll just really briefly take an opportunity to remind all of Council that after the Charles Street encampment issue last fall, we did direct staff to let us know first. We all said very clearly we didn't want to hear about it from our partners or from the media. And so we knew first. And my understanding is that immediately after we knew, our staff did reach out to our partners. So, you know, I can't speak to the minutes and who spoke to who and exactly at what time, but it was our instruction to staff to let us know first. Councillor Shantz.
Thank you. Homelessness is complex, as we've all talked about, and COVID has just highlighted a whole lot of things. But I want to take us up to maybe a higher for just a minute, and maybe I'm on a provincial thing today with the paramedic question and with this comment, and this might be for Chair Redmond or Mr. Lochner. So there's by the time people are homeless, it's a symptom of a broader issue, and so the broader issue it entails a housing market. Employment, mental health, and coming up is also going to be interest rates that's going to affect people's ability to maintain housing. How are we working with the provincial government to look at policy changes? For example, I was talking to a real estate agent who said that, you know, and I think we've talked about this too, the prices are being driven up by investors coming in and buying up houses. So how are we working with the provincial government to solve some of those at the higher level before we get to this issue of homelessness?
Mr. Lochner.
It's a great question, Councillor Shantz, and we could talk about this for a long time, so I'll try to hit some salient points. We, right now, are dealing with the crisis, I would say, and I think all our sector partners in the various sectors would say that as well. So we heard from the mental health system yesterday, they're tapped out. We heard from outreach, everybody's exhausted. Resourcing is hard to find. Even when we do have money, it's the skilled resources that are much needed, because as we know, these are trusted relationships that need to be started and built and maintained. So we will continue to do that until we make inroads, which we are, by doing things like the income redistribution program that we have, like the building 500 units of affordable housing a year instead of 50. As we look at the ROP, and Council is very familiar with this, not just affordable housing in the sense of a house that's affordable, but affordability of housing. And we're coming forward with policies at the local level. We also know it's a multi-sector approach. And we go back to, we've heard about determinants of health, we've heard about, different ways of describing this. But investments in childcare, early childhood development, we know make some of the biggest difference to the future outcome. We know people are disproportionately impacted, as Ryan had in his slide, by systemic issues. We know there are divides along racial divides and other demographic divides and so on. So we have to get to the root causes and the root challenges. And I think our advocacy to federal and provincial government is to not forget those upstream or earlier interventions to deal with this. I think the pandemic has simply shone a light, as you said, on a problem or challenges that existed, and things like inflation and cost increases just make the challenges that much more difficult for so many people in this region. So the strategy is multi-pronged, a long answer, and it's not just the region, it's all the sectors. And I would argue what I've heard from the various sectors, they're all focused on this as well, trying to deal with the immediate crisis and the fires while trying to shift as much investment upstream as possible.
Chair Redmond has a comment.
Thank you very much. If I can just add to Bruce's comments in response to Councillor Shantz's question, I would have to tell you there were two very different and interesting conversations on housing. At the federal level, we talked about supportive and affordable housing. The housing summit that the province had was very much looking at the $1.3 million homes, and it was about supply as opposed to affordability. And I want you to know that at every meeting, and certainly as chair of MARCO, which is the mayors and regional chairs, we continue to bring up supportive housing and affordability of housing, because we recognize that continuum is very important, and it falls on municipalities to shore up that deficit. So in answer to Councillor Shantz's question, it very much is on our radar. It's something we continue to talk to the province about and the federal government, and continue to enforce the fact that affordability and rental stock are huge for people who are looking for housing.
Councillor Galloway.
Well, thank you, Madam Chair. The first thing I want to do is to thank Ryan and his staff and all our community partners for the great work that they are doing. It's frustrating for them as it is for us, and frustrating for the people that need these services and for the community at large as well. And under very difficult circumstances, I think, staff and our community partners are doing as good a job as they possibly can. So great thanks to them and for the great work that they're doing. It's really frustrating, and I think a number of people have already, mentioned the frustrating word, and frustrating is fine, but it still doesn't solve the problems that we're trying to solve. We've made a lot of different investments, doubled the number of shelter beds, and a whole variety of new programs or investments that we've done, but yet the problem seems to be only getting worse. And that's, of course, very frustrating. The first, I have two questions. One is for Ryan, and then I think maybe the other is for Chair Redmond. But the first one is really just a very simple question, Mr. Petitpier. And that is, with the situation unfolding at 100 Victoria, is it on the radar at all that the washrooms that we are funding would continue to be funded and continue to be open? And I guess this is really to provide, the encampment may end up being gone, but whether or not there's a need for a 24/7 facility for members of the community to use. And I'm not sure that's a good idea or a bad idea. I'm not really suggesting it one way or the other. I'm just kind of curious whether or not that's on the radar.
Mr. Petitpier.
Thank you, and through you, Madam Chair. From a regional perspective, what I can say is we'd be open to that consideration and conversation, knowing that the current method of providing them is dependent on a partner. Sure, and their willingness to continue to offer that service. Yeah. What I can add in addition is that we have started that washroom access conversation with our counterparts at the City of Kitchener. So that would be another partner to consider in this equation. either providing access elsewhere or continuing at that site or something else. So as we continue operationally to look at 100 Vic, that's a part of the conversation that will be related to that as well.
Okay, thanks. The other question I wanted or the other thing that I wanted to discuss, and it certainly has been discussed by a few members of council already, and that is the reality that the region is the service manager, the service system manager for the province. And we're given a finite amount of money, and there's some prescription to how that money can be spent. And notwithstanding that, we have, as been indicated earlier, started to use property tax money more recently to augment that. And of course, as we all know, property taxes were never really intended for social service kinds of activities. And of course, then that puts other pressures on things as well. But also the root causes of the homeless situation, not exclusively, but in large part has to do with some mental health and addiction issues, which also are clearly provincial responsibilities. And the healthcare system itself, when it comes to mental health or rehabilitation or all kinds of other services related to addictions, comes through the province, potentially, of course, with some funding from the federal government. And so I guess what I'm trying to say is, and with the recent provincial election just a few days ago, we have some new members of provincial parliament. The two new members happen to be members of the government, but we have some also returning members. And I guess I'm concerned too that the region kind of gets thrown under the bus by some people sometimes at the provincial level, because this is a difficult issue for everybody. But we're only the program system manager, and we operate to large part at the direction of the province. Whether or not it would be worthwhile, Madam Chair Redmond, to maybe convene a meeting with our 5 area MPPs at some point and discuss this whole problem with them and ask them directly for their assistance in advocating at their level for the additional investments that are needed in addictions, additional investments that are needed in mental health care, trying to deal with some of the root causes of homelessness. I mean, those are longer term solutions or potential solutions. They won't be a panacea in a short term, but we you know, with our upstream kind of mantra that we have, and which I particularly and others have been pushing, we really need to address that as part of this bigger issue, and then more specifically in terms of the homelessness issue that is, you know, in our face, and that we have responsibility to deal with on their behalf, asking for, you know, more assistance and more resources to deal with that problem. I'm just suggesting this because you know, we can do a lot here at the region, but we're constrained, and we need the province and to some extent the federal government to be providing the necessary resources and programs to assist us. So I'm wondering whether or not convening that kind of a meeting individually or as a group has any merit. Do you think that has any merit?
Chair Redmond?
Thank you for the question, Councillor Galloway. And I would say yes, that there's a lot of merit. I would have to tell you this is something that Marco is seized with, and the CAOs of the Marco groups as well. We have, I've sent a letter on behalf of Marco. Marco is meeting shortly, and we also have the AMO conference in August. And we have an opportunity to speak directly to ministers, but we are scheduling meetings with the local area MPPs, and this certainly will be on our radar. So I would totally agree that it's a complex problem, and one of the other messages we continually bring to the ministers at the MOU meetings that I attend is that we have to break down the silos. So your point about the Ontario Health teams being involved, CMHC, all of those other resources are absolutely key to being effective in getting people into affordable housing. So I take that under advisement, and it is something Marco is seized with currently.
Okay, thank you, Chair Redmond. Thank you, Madam Chair.
Thanks, Councillor Galloway. I have been puzzled by the tendency of some of our local provincial politicians to point the finger here at the region, and it just seems to me to be such an incredible missed opportunity when they are really in a much better position to make the changes than we are. I did attend the meeting that Mr. Lochner mentioned last night with many healthcare providers as well, and I was also encouraged to hear them acknowledge this isn't a homelessness issue. This is an addiction and a mental health issue. And I was encouraged to hear their willingness to step up. But none of them were saying we have new resources. What they were saying themselves was we will redeploy resources. So we're this whack-a-mole game is just getting pushed down the road. But it's really we're really not solving anything. Councillor Jowett.
Thanks, Chair Clark. Yep, so I don't want to reiterate everything that's been said too much here. We're seeing rising costs of caring for our marginalized population, and yes, high acuity folks is where I just want to put our conversation real quickly. The high acuity, high density people are vulnerable just as much as they create vulnerability, unfortunately, and we have to start paying attention to that. And certainly I want to make it very clear that Cambridge is under-resourced. I want to agree with our mayor very concisely here. I drive around the community all the time. We are highly under-resourced, so I'm really hoping that we can deploy some of these tight resources that we have in the community. I know it's not intentional, but it certainly has been observed by many of our constituents. I also want to just say thanks to Ryan and the staff. I mean, there's nobody like you guys getting at this work that you're getting at. Right now, we're looking at British Columbia pays $1 million a day to deal with their homeless problem, and now the region is nearing $30 million. So we really do need to be cognizant of longer-term strategies. But while we're in the search for those long-term strategies, I think we really have to zero in on, again, this high density and high acuity population with support/security based on the risk assessment. I don't think we can ever go back. We've set the precedent for this support, and I don't think we can ever go back. So I think we have to really pay attention to those risk assessments and try and be a little bit proactive if we can for those using those risk assessments, and really clearly state to our public that we represent 630,000 people. That includes business owners and residents, and it certainly includes our marginalized population, and to serve them better, they also need to be protected. So I'm just going to leave it there, but I'm really hoping that we are headed in the right trajectory of understanding and supporting with the services that might not be wraparound yet because we can't afford it, and hopefully the other partners at other levels of government recognize that they owe it to their communities to do better. Anyway, I'll just leave it at that. Thank you.
Councillor Erb.
Thank you, Madam Chair. And mine are more comments than questions. So is that I'm in order? And would like to echo the comments of the other council colleagues in gratitude to our staff for all the heroic work that they've been doing over the last number of months. And for the report, the detail and perspective of the challenge and the complexity of homelessness that we're all dealing with. The staff report uses the word relentless focus, referring to regional staff and their partner municipalities and service providers. And I'd like to add persistent, a never-ending commitment, continually working day in and day out with their hearts in the right place to find some work solutions. And some in the community have said the region is not doing enough. However, at a staff level, that is just not accurate. Staff have been relentless day after day trying to be creative and innovative in dealing with these challenges, and have gone far and beyond to address the challenge of our homeless population, and thank you to them. And you know, I think it goes without saying that absolutely no one takes any pleasure in the clearing of 100 Victoria. However, for those of us who have the responsibility as members of council, for staff, and for many in our community, that the health and well-being of those living in the encampments, this encampment and other encampments throughout the region, has to be our primary concern. And I think it's become obvious as the numbers have increased that the site, particularly at 100 Victoria, is no longer safe. And no one also is going to argue that this is going to be another traumatic event for those who are living there and now need to find alternative living arrangements. So many of them have experienced trauma in many different ways in their life, and this is going to be another one of those experiences. However, hopefully with the intervention and referral to various support services in the community, we'll be able to help mitigate that trauma. And no one, absolutely no one, wants to live in a shelter. However, if there are no other options, there are spaces, and the region is desperately trying to expand additional spaces. And I think it's worth noting that during the last 10 days, there were an average of 34 spaces available per night, 26 for adults and 8 for youth, for the total of 34 in the shelter system. And no one's going to argue that we don't have enough affordable housing units in shelter spaces. I think that despite the unprecedented amount of money that the region is allocating for shelter and housing, we can't seem to keep space with what's an exploding demand in our community. And while our goal of 500 new homes a year for the next 5 years is commendable, it's not enough. And in fact, we're using our tax dollar from the property base that's been mentioned before to fund this, and it's really not our responsibility, with Ontario being the only province of Ontario that is facing this dilemma. The Premier held a press conference the day after the election where he talked about building highways all over Ontario, and not a word was mentioned about affordable housing. And we can't provide more housing without the support of the provincial government. In 2021, through the Ontario Priority Housing Initiative, we received $3.8 million. The following year, we got $1.6 million less. There is a nominal increase for 2023, and then in 2024, we are receiving another reduction. And this is just not acceptable. There has to be a consistency to the level of funding. And with the crisis we're facing, the financial support from the province should be increasing every year and not going down. So just like staff have been relentless in trying to address the challenges of housing, we need to be relentless in lobbying and advocating the provincial and federal government for additional money so we could try and combat this. And finally, in the report, I'm glad to see that we're taking the initiative to begin with a rapid response approach beginning in downtown Kitchener, which no doubt will take most of the effect after 100 Victoria ceases to exist. I think the rapid response is long overdue and will hopefully meet some of the frontline challenges needed that will hopefully be provided with existing partners through the redeployment and shifting of some existing services within the current region. Thank you.
Thanks, Councillor. Back to Councillor Verbanowit.
Thanks, thanks very much. And some of the other questions that I had have been raised by my colleagues. But I do have some additional ones though. And you know, as we look at this issue and this problem, and you know how we would deal with it, you know, I recognize that we're dealing with a complex population here with unique needs. But having said that, you know, if, for example, we had a tornado hit our community and see a number of houses destroyed and so on, our emergency office at the region would kick in, and we would put plans in place, whether it's temporary housing we would bring in or using hotels or different options to try to deal with the situation. And obviously, you know, if that happened in most of our neighborhoods, some, depending on where it happened, some people would be in a situation to more easily, you know, be involved with that, and some less. Have we looked at any of those options? And if not, should we be looking at those options as ways of helping address this situation? Because we have the encampment now, but we also know, for example, that our 2 shelters in the downtown are closing in a few weeks. And so, you know, I think it's important that we start talking about what some of those options that we're actively pursuing, you know, and to deal with part of this situation. Wonder if staff can comment on that.
Thanks, Councillor Vanovich, and I believe Mr. Lochner would like to speak to that.
Yeah, sure, and Chair, you may want to comment, and Ryan as well. So yeah, we've had many of these conversations. We have, as an example, Edith McIntosh as a potential, and other locations, childcare locations that people have talked about. Edith Mac is a good example where we can't, or providers do not have the staff to safely staff a location. So that's one challenge. The resources, it's not money. We have offered funding. The second thing we've heard loud and clear from providers is, given the burnout in the sectors, given the staff resource challenges, some of the larger sites might be more appropriate. And we know from our experience that us, our partners, area municipalities have been challenged with finding locations, not for lack of trying, but there's some concerns, as well as I would suggest some degree of NIMBYism in this region, like many other communities. So that is definitely on the radar screen, and more of those recommendations are coming forward to council. But again, I would suggest it's predominantly a staffing and location challenge that we have right now.
Okay, I do think that those conversations need to continue. I mean, as you know, we've certainly, everybody's been figuring this out, particularly the urban centers. I know, certainly, we've tried to do it on a number of occasions now in terms of the the work that we've done with a Better Tent City as a city in terms of making locations available for that. But I think, continued use of hotels and other options on an interim basis needs to be something that we're actively engaged in and pursuing, because simply moving this problem from one encampment to another is not the answer. Whether that encampment is elsewhere in Kitchener, they move elsewhere in the region, it's simply moving the problem. And we know that long-term housing stability is the solution. I mean, I know Councillor Erb referenced the in terms of what's available in terms of our shelters, but we know it's not as simple as that. We know there's people who have not been permitted, no longer permitted in the shelters, those who have animals, those who are in couple situations. We know that for various reasons, sometimes there's an unwillingness or an inability to move from one part of the region to another. And so all of those things create some challenges in terms of the 30 some spots that are apparently available in the shelter system. I guess my last question is, Mr. Lochner, in terms of the concerns that you reference around Edith Mack, for example, and the fact that we can't get staff, that we can't get a partner that's willing to run it because of staffing issues up to this point. And so I'm really wondering, I mean, have we come to the point where the complexity of issues in our region can no longer rely on simply community not-for-profits to run these facilities, and in fact that we need to be looking at a staffing model to perhaps take some of this on? And I'll give a very different, a very concrete example. We don't need to be in the seniors home business, but we decided that we should be for very good reasons, and I'm totally supportive of that. So my question is, while we haven't historically been in the business of running, something like Edith Mack as an option, should we be getting in that business?
So I'll start and ask Ryan to jump in. So I think just back to our providers, and I think we all agree and support this, that they are doing the best they can, and I would argue even more than the best they can. It's heroic work, we all know. Absolutely. And not for lack of trying. People leaving the sector, challenging work. We experience that in many sectors, and that one in particular, like the healthcare system, I think is in a precarious state. So believe me, I know our providers and our partners would say if anyone has a location, we have individuals who are currently housed in motels and a range of different housing options. And if we could find another motel, if our providers could figure out a way to staff it, and they work at this 24/7 every single day. So if anybody has any solutions that they haven't found or we haven't found, I know they're all ears. In terms of staffing, and Ryan, if you could comment on this, it's a lot of dollars. So our rates are much more expensive. I think the community providers would suggest that we would be better to resource that sector. It's not saying no to that idea, Councillor Benovic, but I think, Ryan, if you could shed a little more light on that discussion that we've had with this sector, that would be helpful.
Mr. Pettipier?
Thank you, through you, Chair. The staffing question is an interesting one. It does come down to the financial resources at the same time. Bruce is correct in that if the region were to take on staffing a shelter or the entire shelter system, that is again a resource question that we would have to consider incurring. What I would say, if we were to take on one shelter, that could even have an unintended impact on an already fragile system. In that if we are offering different pay, scheduling, and benefits compared to others in the sector, we would compound the very problem that we're trying to solve. So although we can consider it, I would just offer those as two pieces to put in the consideration mix before jumping into that particular equation.
Okay, thank you for that response. And just to be clear, I mean, my preference would be to continue working with community partners who have, for decades, have been doing an incredible job in this community of serving people in need. And I think that's ideally where we go. And if that's, you know, where we need to look at resourcing, that would certainly be my preference. I think we were just hearing that, you know, they're experiencing challenges and concerns, and so, you know, are maybe reaching a max, sort of a max point. And so, you know, I think we need to figure out, either we support them to get to the next step in terms of this, or, you know, we need to look at that other option. But to be absolutely clear, my preference would be to continue supporting them. Thank you. That's all I have.
Thank you. Councillor Jowett?
Thanks, Chair Clark. So Ryan, can I see you? Ryan,
He's gone.
Please don't hide. We really need you. Oh, goodness. Okay, so Ryan, I know you probably don't have numbers at hand, but can you anecdotally respond to what percentage or what number per se of individuals are refusing housing and shelter services in the encampments currently? And then maybe some reasons why.
Through you, Madam Chair, what I can speak to is I don't have the data for all encampments in front of me, but I know in the report specific to the encampment at 100 Victoria, no offers of shelter have been taken to date. How that compares to other offers at other encampments, that's only speaking to one specifically. Can you ask me? Can you remind me of I think there's another part of your question I've forgotten.
Yeah, no worries. So, did you get any of the reasons anecdotally why there's no interest or uptake in the services that we have available on offer for these folks?
Thank you for the reminder, and again, through you, Madam Chair, there are various reasons. Safety, often cited, can't bring belongings. Couples, pets are some of the more commonly cited reasons, not just at this particular encampment, but across all encampments.
Okay, so I was under the impression that, it sort of seems like some of the procedural rules and expectations of other shelter spaces are what's rationale for decline. I'd be more concerned about us resorting to more permanent decisions about shelter systems at our local of regressive taxation. To be quite honest, I'm hearing all my colleagues saying repeatedly that we do need to advocate to other levels of government for support here, and taking a step forward in an initiative like that, it really does concern me that we'd be solving the problem. I'm not suggesting for 1 minute that we don't do everything we can. I really do feel like, and I know the word's been tossed around a lot, I feel like this is human whack-a-mole. And I'm going to say another kind of abstruse word, and I think it's Walmart palliative care. That's what I see. Until we understand that the root causes and the treatment that's necessary and the supports that are necessary, and prioritized, I just see the complexity of this becoming unbearable. Like I said, BC's, Hastings Street, they're at $1 million a day, and the numbers are floating high for a lot of communities. We're not the only ones in this predicament. I hope we can come up with something that's more tenable, more realistic, and more realistic for sure. Thanks.
Mr. Pettipier, I don't want to put words in your mouth, but I understand that we are in fact providing storage for the belongings for people who want to access that, who are at 100 Vic, and I do know that shelters are starting to pilot some sort of pet-friendly model. So work has been done on one of those issues and is being done on another one. Councillor McGarry.
Thank you. Through you, Madam Chair, I had a couple comments and a question. I did again want to acknowledge the incredible, and I think Mr. Lochner said heroic, commitment to our vulnerable citizens that people that are working in this sector have. We see it each and every day. And interestingly, I just spoke to a young woman that is 27 now. She had a commitment to the vulnerable sector and worked in a male shelter and then a woman's shelter for 2 years, and was so burned out that she took a hiatus about a month ago because she could no longer take the work home with her. And I think that speaks to not only the commitment and the passion and the care that people that work in this sector have, but it also speaks to the fact that they are also traumatized, and we're seeing mental health issues amongst them. And I wanted to acknowledge to those on either side of this debate, because sometimes there is division in the community, that when shelter workers, politicians, sector leaders, service providers get criticism from people that are really upset because they've been broken into and don't like the look on their street of the homeless, unsheltered population, but also those who are advocates for our unsheltered homeless, taking personal attacks on those very individuals, such as we see on the screen today, that are doing everything in their power to try and get everyone to step up to the plate. And that really means our upper levels of government. But I can tell you through this woman's experience, I had a couple hours in her presence last week, and I couldn't tell you, I was more impressed with her and felt hope for our future. But in the meantime, she's now having to look after her own mental health, and she's had to take a leave of absence from work. And I think that we as a population, and every single one of us, need to recognize that how we speak to each other, whether it's social media or in public or in council, matters. And we see individuals like nurses, shelter providers, service providers at all levels stepping back because of the level of angst that they feel after being often attacked. So again, it's my soapbox, but mental health and addictions and health issues like this matter, and each one of us has a responsibility to look after each other and not cause more trauma in the future. So I guess my question then for probably Mr. Pettipier would be about low barrier shelters. We do hear of those individuals who cannot be sheltered due to they have pets or couples, or those that cannot follow the rule because they're so active in our addictions. But who is it that could assist in low barrier shelters that could handle some of these individuals?
Thanks for the question, Councillor, and through you, Madam Chair. Our providers work on a continuum based on their own policies about where they would fit in terms of low or medium barrier. All of our shelters would be on the lower barrier side for access to people, but none of them are no barrier either. They have organizations to run and staff to protect. And I think we need to understand and respect that as the first part of my answer. Lower barrier shelters have a higher tolerance for substance use and addictions and some of the associated behaviors. And we are constantly working with our partners to try to find the right mix, the right balance, and a space for everyone in that system. Interestingly, when we look at shelter restriction data for those that are staying at 100 Victoria, it may be intuitive that you would think that the majority of that population would be restricted from most of the shelters. But what I can assure you is that's not actually the case. There are a few people with, there are a few individuals with restrictions at one shelter, but would still have access to others. So would offer that in answer to your question. And any new partner that we brought on would be on that lower barrier continuum for tolerance, still respecting their own autonomy to operate as an organization and ensure staff safety and safety for the population that's staying there first and foremost. I hope that gets at what you were asking, Councillor.
Absolutely, it does, Ryan. And I did want to state that we do have to look to the safety and the mental health of the workers themselves. And I think that you also put it out there why some of the individuals do not want to go to shelters. And, you know, then the reasons are many and complex. And I think that you've just broadened the understanding of the viewing public on these very complex issues. And again, I cannot commend you and your staff and all those that worked in this sector enough for the caring that they do each and every day in order to really provide for our community. Thank you.
Chair Redmond.
Thank you, Chair Clark. Not only is this complicated, this is a long agenda item too. Ryan, I do have a question embedded in this just to put you on notice. I just wanted to clarify that Sunnyside Home and Long-Term Care Act demands and requires municipalities to have such a facility. So just want to clarify that to an earlier comment that was made. So many of these individuals who are living rough do have trusted relationships with the outreach workers. And I think that it's really important to also point out that region staff have been going, and while they haven't accepted shelter accommodations, I think there's at least 2 or 3 people that have signed on to Ontario Works, so they are getting that benefit. So it really has been a person-to-person outreach, which I know Ryan said earlier, and I think that's really important. I also think it's really important that we talk about the immediate, the midterm, and the long-term resolutions. And I don't think anybody has a rabbit that they can pull out of the hat for the immediate remedy for people living in encampments. But I would also point out that the support the region has given to University Avenue with the Working Centre, the House of Friendship on Weber Street, as well as support to a Better Tent City, all speak to those longer term, somewhat innovative solutions that I think will provide a long-term solution. And again, it's not sort of in the immediate term. Ryan, one of the things that has guided us through these last few months, specifically about 100 Victoria Street, was the risk assessment tool. And I know that's something that staff worked on with our partners. And again, we rely on our partners. We invest in funding outreach workers through them, but they are our trusted partners as we go forward. And again, I think it's those long-term trusting relationships with people who are living unsheltered that allows us to offer them help until they're ready to take it. These people have agency, and they can choose to take the help, or they can choose not to. And until they choose to, we just have to keep being there and supplying them with that information. So I'm just wondering, Ryan, if you can talk just a little bit about the risk assessment tool and how we've ended up here. I don't know if this is a question just for you or maybe for Jeff Schelling, but I know that it was really looking at the safety of employees, the safety of our partners, the safety of the people living in the encampment, And I really want to give a shout out to the patience and empathy of some of the retail establishments who, again, we've been in constant contact with. And I'm just wondering if you can sort of round out that picture for all of us.
Thank you, Chair Redmond, and through you, Chair Clark. The risk assessment has been the tool that we've continued to monitor this particular site at 100 Victoria. As you'll recall, Regional Council approved a policy in December of last year that really dictated and supported our approach to encampments moving forward. And predominant in that policy was a service first and connection and establishment approach to those that are staying there from a human dignity and support lens. That is the first and foremost action that we would continue to take to try to resolve the issue. Prior to moving to clearing an encampment, we would engage in a series of risk assessments, and we've developed that tool in real time to manage our response at 100 Vic, and it looks at risk from a number of different perspectives. Firstly, from those that are living at the site, followed by those impacted by surrounding the site or in other ways. There are health and safety aspects to it, serious occurrence aspects to it, and there has been a cross-departmental regional input into not only developing the assessment itself, but completing it. Teams from bylaw, teams from public health, teams from legal, teams from facilities, teams from community services, and also some partners along the way from the community contributing to this risk assessment. And once risk was established to be high, that's as what has contributed to the next step in the region's policy in terms of providing to those occupants that are currently at the encampment. I hope that helps address your question, Chair.
Thank you, Ryan. It does. And just one comment. I do know that the original people that started out at 100 Victoria Street, some of them have left, and I was speaking to one last week who no longer felt that that was sort of a safe place for him, so he's moved on. So just to indicate again that people have agency and they are making choices.
Sorry. Councillor Harris. Councillor Harris?
Oh, okay. I thought I heard something, but I wasn't too sure. So thank you, Chair Clark. Much has been already asked of the items that I was going to inquire. And Ryan, thanks again, obviously, for being available, and to the staff. I had a chance to actually tour the encampment last Thursday. I was there for about 2 hours. I spoke to, I would think, the majority of the individuals at the encampment. And, you know, my clear takeaway, although very, very sad in nature, was the immense need for mental health and addiction services support. So I know you spoke to that. There were obviously folks there from our healthcare partners that were assisting those individuals and ensuring they were getting to their appointments, et cetera. And I guess I would say to you, the one, you know, obviously we've got work to do, not only here in our community, but right across the province and country on this issue. But one thing that did stand out in terms of their hesitancy to go into the shelter system was the belongings aspect of it. And I'm glad that our region did, you know, make available the ability to store some of those items. And I'm just wondering if you can speak to that. And I know that that may be just a simple, you know, one bullet line in this plan as we near June 30th. But I really think after speaking to many of them that was a big, that'll be very important to a lot of these individuals. You know, they explained how, you know, the few belongings that they do have would be very difficult to track it around, knowing that they have to be out by 7 or 8 in the morning. So I don't know if you can further elaborate on what the region is doing to assist these individuals with their belongings as we deal with this most difficult period of time.
Thank you, Councillor Harris, and through you, Chair Clark. I'd offer two pieces of information in response to your question. We have made a commitment to provide storage and access to those staying at 100 Vic for their belongings as we look to work with them to relocate. The specifics I'm not able to comment on at this point. We're working on that operationally in terms of the logistics of the space, but also the access to the space and storage that works for the individuals at that site. And we'll be doing that in consultation with those individuals, asking the question and keeping them at front of mind in terms of what would work for you, what would be most easily accessible, and how would that work. And then we will endeavor to provide this service either regionally or probably more beneficially through a community partner that already has an established and trusted relationship that can help facilitate that particular service.
Yeah.
The second part of my answer, Councillor Clark alluded to earlier, we are interested and have started, some shelters have started already offering a storage service for the population. And we are interested as a division enhancing what's available at our existing shelter sites, knowing that it is a barrier for people to access shelter.
Yeah, I mean, obviously there was a time too when individuals were collecting scrap metal, to be able to turn in to make a few extra bucks here or there. So they were using, the site for storage of those materials. I guess I just end on the fact that, and I know last night there was a meeting with our CAO and other health partners, but to really stress on the need to further bring those folks together that will support them in, their mental health journey and combating those addictions, and I don't know if you've left anything out on that that's not already been answered or asked about, but I definitely felt after speaking again with most of them that those are some major hurdles. And, to think that there's an affordable housing unit available, most perhaps, and I'm no healthcare professional by any means, and I'm not going to pretend I'm one, but most would struggle without getting those proper supports. And I don't know if there's anything else you want to speak to that after last night's meeting to really call on those community partners. And I know they've stepped up, but to further step up and help assist these individuals as we approach June 30th. I had a chance to speak to the local business as well in and around that neighborhood when I was there, and some residents. It was a very busy corner. There was an accident out front of the site, so close to the road as well. So, I know it was a very difficult decision that the region had to take on this, but it was the right one based on the policy that we have in place. And so, again, I want to thank you and your staff. I had the opportunity to meet, several of them out at the site, and know that they'll continue to be as compassionate. So I don't know if there's anything else on that mental health and addiction side that you've not already answered, but I'll leave it at that.
Through you, Chair Clark, I will take the opportunity to comment. And I did speak to it in my presentation, but I'll take the opportunity to highlight it again. Without those mental health and addictions and primary health supports, we're not going to be able to get the homeless population housed and keep them housed. And I think that's critical to the work that we do. And those aren't services that we at the region are directly funded to provide. And that's the dilemma that we consistently find ourselves in. Do we step into that breach knowing that there's a gap and it's the right thing to do versus managing a finite level of resources? Absolutely critical to solving the problem, not just managing it at the unsheltered level. Thank you.
I'm going to take the opportunity, seeing no other questions, to end this on a positive note. I think I will repeat what Mr. Petitpier or someone mentioned earlier. We did house over 500 chronically homeless people in the last year, and many, if not most of them, were housed in supportive housing, either fixed site supportive housing or housing with mobile supports attached. We did open another 40 units of supportive housing this month. We have another 45 units that are scheduled to come online this summer. We have another supportive housing project that should be opening in early 2023, and more in various stages of development. So this work is happening, and we should be taking a lot of comfort in that. It's not happening overnight. But let's break for lunch, thinking about that accomplishment instead of all of the challenges. We're going to take a 30-minute lunch break. We will need a motion to adjourn, though. Sorry, I'm sure I won't have any difficulty getting a mover, Councillor Jowett, and a seconder, Councillor McGarry. All in favor? Please use your yes or no button. And see you back here at 1:25. By my watch.